Hello, and welcome to Tech Talk, where you will hear the latest in technology and investment trends directly from the trendsetters. I'm your host, Janina Teoxon, member of EisnerAmper's Technology and Life Sciences practice, and with me today is Dr. Gregory Simpson, a very accomplished cognitive neuroscientist who is also the founder and chief executive officer of ThinkNow, a startup focused on creating software tools for cognitive enhancement and well-being. Before we dive in, don't forget to hit that like button and subscribe to EisnerAmper wherever you listen to your podcasts. And you can also find us on YouTube at EisnerAmper. In this episode, we'll hear Dr. Simpson's unique journey to becoming a founder and how his company is using innovative technologies to enhance cognitive performance, mental wellness, and disorders of attention, including attention deficit hyperactivity disorder, or ADHD. Today's insightful conversation could influence next steps for your startup. Dr. Simpson, thank you for joining me today.
Great to be with you, Janina.
All right. My favorite part of being an accountant and advisor is getting to hear about their founder journey. So can you tell us a little bit about how your unique experiences have shaped your approach to building ThinkNow?
Oh yeah, I'd love to. It's a bit of an unusual story, I think. In the 1990s, I helped create the Mind and Life Institute with my neuroscience colleagues and the Dalai Lama. And the mission was to integrate Western neuroscience and Eastern introspective science of the mind, and to use neuroscience methods to examine the brain mechanisms of meditation methods and the changes that occur with meditation or training of the mind. I spent about 5 weeks in Dharamsala with the Dalai Lama and other monks, and I came away from that experience with two key things. One was that their knowledge about attention strongly reinforced my theories of the many facets of attention that we're working on in my lab. And the second was super important. They provided a fantastic proof of concept that attention is a set of skills that can definitely be improved. In the West, it was thought that attention was immutable, not something you could improve. So this was a big deal. And back in my neuroscience lab, we were studying the brain mechanisms of attention, and we designed software that could change how people paid attention in a short amount of time. So I knew we were onto something there, that we could help people build better attention skills. But we needed a small supercomputer back then to do it. So it wasn't exactly scalable. So that went on the back burner. And if you fast forward about 30 years, as a director of the Dynamic Neuroimaging Lab at UC San Francisco, the iPhone came along. And I could see that we had a huge opportunity there. I left UCSF and I started ThinkNow to bring all the science into an app that could literally help millions of people take back control of their attention. And since I had also trained as a clinical neuropsychologist, I was passionate about helping people improve their mental health.
At EisnerAmper, we are creative problem solvers that take a 360-degree approach focusing on you. We're an award-winning firm with decades of experience. EisnerAmper, let's get you ready.
Wow, that's such a powerful blend of personal insight and professional experience. It really adds depth to the mission behind what you're building. And from a business advisory perspective, it's important to understand, right, the company's mission. It's very crucial. So can you explain your startup's mission for our audience?
Oh, yes. Our mission is to empower people to take control of their attention with clinically proven software solutions. We create tools that help people live a better life.
Now that we understand the why behind ThinkNow, tell us, what is the specific challenge that you are aiming to solve?
There are over 1 billion adults worldwide with ADHD and attention impairments and that need a therapeutic other than drugs. That number is so huge because in addition to a large number of folks with ADHD, there are twice as many people that have substantial attention issues that are not diagnosed with ADHD. For instance, these are people that may have ADHD but never sought a diagnosis. That's the case for a lot of women. There are people that had ADHD as kids and somewhat outgrew some of the symptoms, so they don't quite reach criteria for diagnosis any longer, but they still have substantial attention problems. There are those that have always been borderline ADHD, so they never really reach criterion for diagnosis. But if you have 90% of the symptoms, you have a lot of struggle with attention, but you just can't be diagnosed. My colleagues and I'd say, would estimate there are easily 15 to 20% of the adult population in this situation. And the problem is that there's no well-accepted therapeutic for the actual attention dysfunction other than medication. People, of course, that are not diagnosed can't get medication. And the majority of adults with ADHD don't want to take drugs due to cost or potential negative side effects. And for many people, they don't work the way they'd like them to. So this leaves a huge underserved market that's struggling with attention impairment. And that's a big part of why I ThinkNow created this entirely new therapeutic method to improve attention impairment in these people. It's a non-drug, over-the-counter therapeutic.
Wow, that's an important work that you're doing today, right? Like mental health, mental well-being is so relevant today. But Dr. Simpson, when we look at the mental health space overall, it's becoming increasingly crowded. I know you touched on this a little bit, but how does your approach stand out from other competitors in this market?
Attenteo, as the product, is an NIMH-funded product with a patented novel therapeutic method. It works in an easy-to-use app. This is akin to what pharmaceutical companies would call a new method of action, or MOA. So it's a big deal to have a new therapeutic method. There's not been a new behavioral therapeutic method to improve attention control in ADHD for many years. The only recognized therapeutics that improve attention dysfunction itself are medications. And the majority of adults don't want to take them. All the other products in this crowded space, as you're saying, are coping methods, such as helpful organizational tools, skills, strategies that help dealing with the struggles that ADHD creates in our modern world, but they do not improve attention control dysfunction itself. My colleagues in psychiatry and psychology and coaching can help with tips for managing life, provide super helpful therapy to deal with anxiety that's created and exacerbated by ADHD, but they do not have a method for directly improving attention control dysfunction other than medications. And I think that's why they're so interested in our product.
Right. So that really highlights how you're carving out a unique space in this growing field. And the fact that this is an NIMH funded, they must be really, seeing the real world potential of what you're building. And I know that a big part of turning that potential into impact is how you harness technology. So how are you using technology to accelerate your solution at ThinkNow?
Riffing a little bit on what you had just said, we built this technology through a 10-year R&D pipeline funded by NIMH with 5 successive awards. So they were doubling down on us. And then ThinkNow has 4 patents with 2 more pending for its technology. Attenteo takes advantage of the technology in an important way. Attenteo integrates deep neuroscience understanding, learning science, and unique software design into an easy-to-use mobile app. And of course, because it's a mobile app, it's highly scalable, so we can reach lots of customers that need help quickly and cost effectively. We'll also be using AI and data science to improve the product. We are building a proprietary, unique database that's never been seen before that will really revolutionize our understanding of ADHD and related attention impairments. We're able to characterize the nature of ADHD in day-to-day life through people's use of this app. We'll be collecting just amazing data that's never been seen before. And that will enable us to use AI to enhance the benefits of the product. Attenteo can utilize analyses of the user's performance, self-report, tracking, engagement, all sorts of data that can be used to provide personalized care for each user. We'll also have AI recommended personalized treatment plans for each user to optimize their benefits. We can have text-based chat coaches that provide accountability and coaching. Accountability is really important with ADHD. People with ADHD have a hard time sticking with things. So that's going to be extremely valuable. And we're using machine learning to find patterns across all these data I've been describing, across users and within individuals. And we can present those patterns to the individuals as helpful perspectives and learning experiences to greatly amplify the benefits of the product.
Wow, that's amazing. I love seeing how you are integrating tech, not just for efficiency, but for, real human-centered impact. Now let's talk a bit about the business side of building all of this. What stage or funding round is your venture currently in? And what do you see as the next step?
Well, I think we're different from the majority of pre-revenue companies that are raising seed-level funding in that we've raised over $7 million in non-dilutive funds from NIMH to complete that pipeline and conduct clinical trials. And that's taken us to our current inflection point, really. We're now entering the commercialization phase with a clinically validated therapeutic. And so we're currently seeking about $1 million to complete our $2.5 million seed funding. So we're pre-revenue, but we're not really at an early stage in the typical sense.
Nice. Okay, that sounds like an exciting phase of growth. I think now for sure there's lots of opportunity ahead. And Dr. Simpson, I know this isn't your first time advising or building in this space. You've actually been an advisor to several biotech and health tech startups. So for my last question, what's your biggest piece of advice you've shared with these founders?
I would say follow your passion. I mean, I know that's a cliche, but it's so true. Passion and good ideas will carry you through the rough times. I'd say that you want to focus relentlessly on solving a real problem for a very specific audience. But you also have to be prepared to adapt based on the feedback and learning. You have to learn and adapt. It's easy to be passionate and about your ideas and be stuck to them, which is not a good thing. You also need to build a great team that works together and provides more than just the sum of its members. I think that's extremely important. I mean, I've been fortunate to build a wonderful team that has extensive expertise and compassion and commitment. We have deep neuroscience expertise, extensive business expertise from serial entrepreneurs with prior IPOs. We have an amazing creative team led by someone with tremendous game design experience, for instance. A great dev team led by a former senior technical director at Industrial Light and Magic and DreamWorks. We have business advisors with extensive experience in digital mental health. We have scientific collaborators that are world-renowned ADHD experts and good colleagues of mine. So you really want to build out the entire team and all facets of it. But I think maybe even more, almost more importantly, expertise, experience, wisdom are important. But building a team with the right chemistry is absolutely essential. You need a team that works well together. You can have a great leader, but if the team just doesn't work well together, you'll just be constantly fighting an uphill battle.
I love that. I'm an accountant, but I do also work with a lot of teams, so I resonate with that. It's really all about building a great team, working together, collaborating. So that's such a great reminder, especially, for founders out there who might be navigating both innovation and impacts. Dr. Simpson, thank you so much for sharing your insights, your expertise, and for the incredible work you're doing at ThinkNow.
My pleasure. Thank you for the opportunity, Janina.
Of course. And for those who'd like to follow ThinkNow, what's the best way to connect with you?
So they can reach me through the website, think-now.com, and through LinkedIn for Gregory V. Simpson.
Awesome. Thanks again for joining me today. And thanks to our listeners for tuning into Tech Talk, the entrepreneurs and innovators who turn to EisnerAmper for audit, tax, advisory, and outsourcing solutions to help propel your business forward. Again, subscribe to the EisnerAmper podcast to listen to more Tech Talk episodes, or visit EisnerAmper.com for more tech news you can use.